What's up, guys? My name is Takeyah. I am an orthodontic assistant. However, before becoming an orthodontic assistant, I was a dental assistant in general dentistry. So today I'm going to basically talk about my experience going from assisting in general dentistry to now orthodontics. So we'll be going over the differences. All right, let's go. When I started assisting in general dentistry, I was assisting with one doctor. It was a private practice, and I was just basically assisting the one doctor. Before I started assisting her, she did everything on her own. She didn't have an assistant. She just was used to seeing patients and doing everything by herself. When I first came to her office, I was just going there to shadow, learn about dentistry and to get my hours. But after I was there for maybe like 2 days, she just threw me in there and was like, go ahead and be my assistant. I don't have an assistant, so you can, get hands-on experience. So I started assisting her every time I came there. We would do extractions, fillings, and she also had a lot of patients who had like special needs and needed extra attention. So I was able to gain experience working with different type of people who needed extra care. Some of them had like just different disabilities. Some of them came in wheelchairs. So I was able to learn, how to assist those type of patients. When I was assisting her in general dentistry, yes, I did suction, but I also did help her set up, handed her the different instruments that she needed, and then of course cleaned up. I didn't do any records or anything like that. My experience as an assistant was just mainly clinical. I did run the instruments. We did have a hygienist, but the hygienist was only there certain days, and the hygienist basically made their own schedule. So I was with the doctor 24/7. The doctor was really more hands-on than what I'm doing now in orthodontics. After doing that, I didn't kind of just stay assisting just her. I quickly started shadowing other doctors, gaining my shadowing hours, because at the time I was trying to gain hours for dental school. And it wasn't dental assisting school, it was the regular dental school to become a dentist, which requires a certain number of shadowing hours. So I was trying to get all of that completed. So after I shadowed her, I quickly shadowed a different general dentist, and at that office I did help assist, and I basically was doing the same thing I was doing at the previous office, because after so many times showing up and just shadowing, I was just, proactive. The doctor seen I was proactive, and I was able to quickly assist the dentist instead of just shadow. I quickly learned, the numbers of the teeth, everything that a general dental assistant would do on a day-to-day basis. Right now, I'm assisting in orthodontics. I started assisting in orthodontics maybe, I think, 2 years after assisting in general dentistry. I did take a break in between. When I started assisting in orthodontics, it was totally different from assisting in general dentistry. I was now seeing the patient by myself, and I was now doing all of the work. I know we're called orthodontic assistants, but if you do your research, a lot of times orthodontic assistants are usually called orthodontic technicians. And I realized they're called orthodontic technicians because they're actually not assisting the orthodontist. They're doing all the work. There's really no type of assisting going on. So technically it's like orthodontic technicians, not assistants. Once I started assisting in orthodontics, of course I didn't go in right away assisting, knowing how to do everything. I was trained on the job, so I did shadow and watch for like a good 2 weeks. In orthodontics, as an assistant, I do everything. Do records, we do the procedures. The only thing the orthodontist does is put the braces on. The orthodontist will bend the wires, because when they bend the wires, they want the teeth aligned in a certain position. And then the orthodontist ultimately, comes up with the treatment plan, lets the patients know how long the treatment will be, and answer any questions, usually at that first appointment. Also, in between the procedures, when we complete the work, the orthodontist, they do come over either after the work is completed to just check to make sure everything is good, or they will either come over before to check the patient, and they will tell you what to do. Usually, if they don't come over before to tell you what to do, it's already written in the chart what the orthodontist wants you to do for that appointment, and they will come over at the end to check to see what you have done. So that's totally different from being a dental assistant in general dentistry. As an assistant in general dentistry, the doctor was there the entire time. I was actually assisting the doctor. The doctor did all of the communication with the patients and the parents. Now, as an assistant in orthodontics, the doctor's not there. I'm with the patient the entire time. So usually any communication that's going on is usually with myself and the parent and the patient. Usually the orthodontist does address questions and concerns when they're at the chair, but more than likely you'll find yourself having to do most of the communication, because the doctor's only there either in the beginning or the end. And most of the questions arise during the procedure, while the patient's getting things done, because that's when they start thinking of questions. So as an assistant in orthodontics, I do have like more responsibility, and it's a lot more work. I had to train longer and watch and shadow longer before I can start working hands-on as an assistant in orthodontics. Where as an assistant in general dentistry, I didn't really have to shadow at all, even though I was getting shadowed hours and I did shadow before. But I was able to just go in right away because the dentist was always there and I was assisting the dentist. So the dentist always told me what to do, what instrument to grab, and how she liked to do things. So I was able to, work hands-on right away. As an assistant orthodontics, I had to watch the assistants, a couple of weeks and learn everything before I can go in and start everything, because it was a lot of information and a lot of things I had to learn. There are differences in general dentistry and orthodontics, like starting with tooth numbering. The numbers are different in general dentistry than it is in orthodontics. In general dentistry, we number the teeth 1 through 32. Starting from the upper right, you start with 1, 2, 3, 4, 5, 6, 7, 8. We go all the way across, like 1 through 16 for the upper, and then you go 17 through 32. Each tooth is numbered. Where in orthodontics, we don't number the teeth that way. We start from the midline. So when you look at the patient's teeth, we start from the midline and we go across, one this way and one this way. And for our numbering, we number 1, 2, 3, 4, 5, 6, 7, upper left. Well, this is my left. And then upper right, 1, 2, 3, 4, 5, 6, 7. And then when you go down, it's the same thing from the left. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. So the numbering is simplified. That's for adult patients. When you're seeing children, of course, baby teeth are they aren't numbered, they're lettered. So in general dentistry, when you have baby teeth, they number A through T. So it's just the same thing as general dentistry. You go A this way, and then you just work your way around until you get to T. And you see baby teeth in orthodontics, they letter it differently. So again, we start from the midline and we go upper left and upper right, lower left, lower right. So when you have baby teeth, we number our teeth A through E, A, B, C, D, E for the upper left, the upper right, A, B, C, D, E. Lower left, A, B, C, D, E. Lower right, A, B, C, D, E. In general dentistry, they work in quadrants. So you will have quadrant 1, 2, 3, and 4. You have the quadrants. You're going to have the upper right is quadrant 1, the upper left quadrant 2, the lower left quadrant 3, the lower right quadrant 4. So usually if a doctor is like speaking or working, they'll talk to you and say quadrants. They're working quadrants, and then again the two numbers 1 through 32. In orthodontics, we don't work in quadrants. We basically just specify upper and lower. Again, with the tooth numbering, we start from the midline 1 through 7, 1 through 7, 1 through 7, 1 through 7. So when we address teeth, we will say the upper left 1, or the upper left 2, upper left 3, upper left 4, upper left 5, upper left 6, upper left 7. Going to the right, upper right 1, upper right 2, upper right 3, 4, 5, 6, etc. Lower left 1, 2, 3, etc. Lower right 1, 2, 3, etc. It's really simplified when numbering in orthodontics. So if the orthodontist says, hey, I need an upper left 1. Upper left 1 is going to be this tooth here. It's going to be the centrum. If they say, hey, I need a upper left 3. 1, 2, 3. Upper left, that's going to be the upper left cuspid. That's going to be your upper cuspid on the left side. Say if you have a patient who still has baby teeth, they can say left C. That's going to be the primary cuspid. Primary meaning baby. That's going to be the upper left one. Another difference between orthodontics and general dentistry. In general dentistry, we see about 6 to 8 patients. When you have a schedule, of course, you'll have 2 columns in general dentistry. You'll have a column for the hygienist, and then you'll have a column for the dentist. When you see the dentist column, you'll see about 6 to 8 patients, because those appointments are usually longer. You can have a fill-in, extractions, you can be doing root canals, you can be doing basically any one of those type of things, and those appointments are long appointments. So usually you're only going to see 6 to 8 patients, where in orthodontics we see about 75 to 100 patients. I know you're probably like, wow, but we see those many patients because our appointments typically are about 15 minutes. The majority of our patients are adjustments. Adjustments are appointments where you only get your wires and your colors changed. That doesn't take long to do, so that usually runs about 15 minutes. So since that's only 15 minutes, we're able to schedule many patients on our schedule. The longest we have blocked off for a long appointment will be about maybe an hour, and those long appointments are for bondings. Bondings is when we put braces on. That usually takes about an hour. And we also have a debond, which is a long appointment, and that's when you get your braces off. That will be blocked off for an hour. In orthodontics, we usually will have, for my schedule anyway, we will usually have 4 bondings, and that means 4 people getting braces on. So that's already 4 hours blocked off. And then we also usually have 4 debonds a day, and that's when you get your braces off. So we will have another 4 hours blocked off. So we have a total of 8 hours blocked off for long appointments. The remaining 8 hours are scheduled for adjustments, which are about 15 minutes. So that's why we see that many patients. Also, another difference, in general dentistry, you're usually working with one dentist, and you have one dentist at a practice. In orthodontics, we have about 1 to 2 doctors. So when I have a full schedule, like 100 patients, I usually have 2 doctors working that day. So it's not just one doctor seeing all of those patients. It's usually two doctors seeing all of those patients and, just balancing the load. You may have practices where you have more than one dentist, but usually in general dentistry, we have more than one dentist. That's usually a big office and a corporate office. But in orthodontics, you'll find multiple doctors, private and corporate. That's just usually how orthodontics is ran. 1 to 2 doctors. In working in general dentistry, you usually will have only one assistant assisting the doctor. Where in orthodontics, we have 6 assistants. It's really different. I have only worked and seen general dentist office with one assistant. I know you may have maybe 1 or 2 assistants, but from my experience, it's only been 1 assistant. And brings me to another thing, the downfall of having 1 assistant. You cannot just call out in general dentistry when you're the only assistant, because when you call out, it's like there's no assistant there to work or cover for you. Where in orthodontics, you have 6 to 8 assistants. If you call out, the schedule will be fine. They can still work and they can still manage. And you don't feel bad about calling out because you'll have coverage. Where in general dentistry, if you call out, you do feel bad. They do have to adjust the schedule. It's something that you have to get used to, being the only person to do the load. And then if you go on vacation, in general dentistry, that you have to, make up that work that you missed. Where in orthodontics, if you go on vacation, there's nothing really to come back to. You don't have to come back to missed work or rescheduled patients that had to be moved around, because the office is still open and the patients are still coming in and everything is still rolling because we have many assistants. In general dentistry, when taking x-rays, they only took intraorals, and then we would take additional x-rays, if the dentist needed it. In orthodontics, we only work with 2 types of x-rays. We do a panel and a set. The panel and the set is usually taken in the beginning before the patient gets braces at their records appointment. At the records appointment is when we do those 2 types of x-rays, and then we take pictures. Sometimes we will get another panel in the middle of treatment so the doctor can just check the alignment and the roots of the teeth. But other than that, those are the only x-rays we take. We don't take intraorals or any of that. We just stick with the panel and the set. And those x-rays are really simple and easy to take. Unlike the intraorals, you have to, practice with that and learn how to take those. With the panel and the set, you just basically reset the x-ray machine, get the patient covered, hit the button, and the x-ray does all of the work. Just, really simple. In general dentistry, you have the hygienist to prophy the patient and do deep cleanings. In orthodontics, we prophy the teeth before we get braces on. So that's something that's different. We don't send our patients to get cleanings before they get the braces on. We do check with their general dentist to make sure they've seen their dentist and their hygienist within the last 6 months. But when they come in to get braces, we, the assistants, prophy all of the teeth before we get the braces on. For dentistry, you're gonna typically work 40 hours a week, Monday through Friday. In orthodontics, we only work about 32 to 36 hours a week, and we only work Monday through Thursday. That's full-time for us. If you research orthodontic assistant jobs, typically you'll see 32 to 36 hours, and that's considered full-time in orthodontics. Hope you guys enjoyed this video and learned some new things and differences between general dentistry and orthodontics. Go ahead and comment you may have. Make sure you like this video, subscribe, and I'll see you in the next video. Bye.